But anyway, there is that sort of general meme that floats around through the reptile community. I think it's getting a little bit better, but we still see it quite often where people think that vets really don't know anything. So as far as you're concerned, where do you think that myth came from?
I think there's probably a combination of things. One is we are still learning a lot about reptile medicine. I mean, if you wrote a book about reptile medicine, which people have, you can probably just have a book. Whereas if you write a book about, dog medicine, I mean, you're going to fill a room with it. There's just so much more that we know about other species. Unfortunately, we are seeing more, of the ball pythons with respiratory disease, and a lot of them, I'm recommending tests for nidovirus, and they're coming back positive. So that's one thing that's definitely scary that we're seeing more of. I saw a king snake that had eaten his tail and was starting to digest himself.
Oh my gosh.
That's probably the weirdest one.
Welcome to episode number 103 of the Animals at Home podcast. My name is Dylan Perrin, and thank you so much for tuning in today. Now, before we get any further, I just need to say something real quick. If you hear an annoying vibration or a buzz or a rumbling sound through this intro, they are paving the road just outside my building right now. There's a grader going back and forth, and it is literally shaking my entire building, including the enclosures, and they're rattling around. I'm basically yelling to get over that sound right now. I can't tell if it's being picked up on the microphone until after I edit it, so just in case, if you do hear an annoying rumble, then I apologize. It will not be present in the episode. It's only going to be present during the intro and the outro. Okay, so having said that, joining me on the podcast today is Dr. Catherine Love, who is a recent veterinary grad out of Indiana. Dr. Love specializes in reptiles, and we discuss several different aspects here. First, we discuss the schooling of reptile vets, what it means to become a reptile specialist on the veterinary side. We discuss that sometimes contentious relationship that keepers have with vets, especially you see online, a lot of people saying, don't go to your reptile vet or don't take your reptiles to vets. They never know what they're talking about, and you're gonna hurt yourself or hurt your animal by taking them there. We discuss where that myth came from and how to get around that myth. Dr. Love gives us a quick rundown of sort of the day-to-day life in the clinic. What are the common ailments she sees patients coming in with? We talk about nidovirus, a little bit about crypto. We discuss a stint that she did in Australia for a rotation, which was really fascinating. And Dr. Love also lets us know how she stays up to date with the forever evolving reptile husbandry information. As you know, we're constantly pushing the envelope, constantly advancing, and it's actually really important that veterinarians stay on top of that as well, so she kind of walks us through that. This is a great episode for those who are nervous to approach their vet or are unsure of how to find a good vet, and also if you're somebody that's sitting at home and you think you might want to go into veterinary school, this is a great episode to sort of give you a little bit of outline on how that might look and how you can go about doing that. If you're looking for more information on this episode or any of the links discussed in this episode or any other episode that has been recorded, make sure you head to animalsathomenetwork.com. If you'd like to join us on Patreon, head to patreon.com/animalsathome. There you'll have early access to the episodes as well as the opportunity to submit questions to upcoming guests. And we also do Zoom hangouts every 4 to 5 weeks with my friend Liam over at Reptiles and Research YouTube channel. We bring in some of his listeners, some of my listeners, and we hang out on Zoom. And we also sometimes bring in a special guest. Last week we brought in Paul from Custom Reptile Habitats, and he talked to us all about the reptile enclosure business, which is a really fascinating conversation. If that is on YouTube, you have to be a patron to access it, or a patron to access it. So if you are interested in listening to that or being involved in any of those Zoom chats in the future, make sure you sign up there. And thank you very much, speaking of Paul, to CustomReptileHabitats.com for sponsoring this episode of the podcast. You can find affiliate links in both the YouTube description as well as on the show notes. Let's jump into the episode. Enjoy. Dr. Love, welcome to the podcast. Thank you for being here.
Thanks so much.
It's always great to have another vet on the podcast, and we're going to get into the conversation about reptile vets later because, this is one of those topics where we probably don't utilize them enough, and there's myths surrounding reptile vets as well. So, But before we do that, I know we were just talking before off air, you have a few reptiles behind you. How long have you been into herpetoculture? Is this something that started as a kid, or did you get into keeping reptiles once you got into vet school?
I think I have a pretty similar story to a lot of the people you have on that, I was out catching toads and snakes and all that. I vaguely remember we had newts and anoles that, I don't remember what their names were. But when I was in middle school, my parents finally let me get a bearded dragon, and I honestly did not take good care of her. Looking back on it, I thought I was so great, but I had the Kelsey sand and kind of the typical beginner mistakes. So I don't feel like I really got into, the evidence-based keeping until vet school. I got my ball python in undergrad, and kind of just was realizing I wasn't doing right by him. And then I started finding, like the advancing herpetological husbandry, and realizing, wow, husbandry is really interesting. And that kind of sent me down the rabbit hole.
Was being a vet always was that your goal from just a child, or did that kind of morph along the way?
Yeah. I definitely, some of my earliest memories of, playing with friends, we had the stuffed animals that we were bandaging and taking care of. I think I had a little stuffed dog that I set on top of a light, and it got burned, and so I had to put a bandage on it. And that was like, oh, this is what I want to do. And of course, when you grow up, you realize it's not quite that luxurious, but I can't imagine doing anything else.
Yeah, it's because it's fascinating. So many kids have the goal of being a vet, and then when you realize what it's like, yeah, I actually don't want to do that. It's not the job it's not bandaging up stuffed animals. When we're kids, it seems so good, but from the very beginning, you've always wanted to be it. And was there ever a point where you thought maybe you wouldn't want to be a vet because the schooling is incredibly difficult. It's hard to get into school. I don't know what it's like where you are, but here in Canada, it's very difficult to get into vet school. I'm sure it's the same for you. And then the school's challenging, and then the job itself is challenging. So was there any part where you were sort of wavering?
Yeah. When I got old enough to realize that, oh my gosh, I'm going to have to, euthanize animals, and there's going to be blood and surgery. So maybe around like the early teen years, I was wondering if I really wanted to do that, but kind of came back around to it. And really since late high school, there was nothing else that I really could imagine doing. I mean, certainly sometimes when I was in vet school and you have the 10 exams coming up, you're like, is this really worth it? But other than that, I never really wavered.
So when you went into vet school, as you said, you got your ball python in undergrad, so you must have had your peak of, or your interest in husbandry was starting to peak again. And were you already thinking you would want to tilt towards reptiles as far as being a vet goes, or were you kind of more broad at that point?
So funny enough, I was actually really interested in farm animals. I went into vet school saying, I will not do any small animal medicine. I don't like it. I want to work with farm animals and maybe get into some kind of wildlife conservation. And I mean, I liked reptiles. I had a snake and I wasn't opposed to it, but I just really loved being out on the farm. And it wasn't really until my second year, I went to an exotics conference and just by chance ended up going to a lecture on reptile medicine and surgery. And it was like something clicked in my brain. I was like, oh, that's what I want to do. I want to do that. Can I specialize in that? And from there, it's just been like kind of a nonstop spiral into reptile medicine since then.
That is quite a difference between going into farm animals. And I'm always impressed by farm animals because they have to deal with animals that can really, really hurt you. It's always amazing that, and they seem so like brave, grabbing horses by the feet and whatnot. But that is quite a shift to go from one to the other. So what was it about it? Was there anything in particular, or was just that deep fascination was already there? So it just swelled at that conference?
Yeah, I'll be honest that by that point I was kind of realizing like, oh man, I really do not like working with horses as much as I thought. I like riding them, but horse people are, if you've ever been around horse people, anyone will know what I mean by horse people. And it's just was realizing that it wasn't really for me. And I was questioning what exactly do I want to do? And I was kind of going back around to, well, I really like reptiles and exotics. Let's just go to some conferences. And I don't think I have a really specific thing that caught my interest. There was just all these pictures of these, not even anything special, just bearded dragons and corn snakes and things. And it's like, oh my gosh, like, of course you can do surgery on them. It just never occurred to me that you could specialize it. And it just was something that clicked in my brain. I don't have a great reason other than I just really thought it was cool.
Yeah. If someone is listening to this and they are thinking of going into vet school or want to be a vet, is there any advice that you have for them that you wish you knew before you went down that path?
Yeah. I definitely, think really hard about it. I love what I do, but I see a lot of my friends and colleagues burning out. I see a lot of mental health issues. So just be really sure that it's what you want to do. Spend a lot of time shadowing different types of vets, not just a small animal vet. Get experience, even if you don't think you want to work with that species, just learn as much as you can, be around as many types of vets and research and animals and everything that you can to get the experience and make sure that you really want to go into this.
Yeah, I've heard the mental health issue about vets before. Do you think that's just the stress of the job, or where does it mostly come from?
I don't think they really know. Part of it is, at least in the US, the debt is so bad. I mean, most of us are 250, 300,000 plus, and we don't make nearly that much. I mean, really not even close. So just paying back.
People always think vets are making tons of money, but it's not quite like that.
Right. And I don't know where that comes from, because we really don't. But that's part of it. Part of it is, long hours. We're expected to basically do the job of a bunch of human specialists. We're physicians. We're doing surgery. We're doing specialty work. Part of it is that those of us that have mental health issues, that are anxiety prone, are the ones that tend to gravitate towards animals and are detail oriented. And part of it is, just we end suffering. And so I think, without getting too much into, a sensitive topic, I think a lot of us in our mind, when we're suffering, we tend to go in a certain direction that ultimately ends very sadly.
Mm-hmm. Yeah, that's definitely the challenging part of that job for sure. And I know I've talked to other vets as well, and partly it's a challenge because you have people bringing in their pets, and the surgeries and the treatments are not cheap. Mm-hmm. But that's it's not, and I don't say that as like it should be more inexpensive. It's you're paying for what you get, but it is an expensive amount of things you have to go through: medication, surgery, and whatnot. And a lot of times people don't want to pay it, or sort of look down on vets. Why are you asking me to pay this bill to save my pet? Like, do you experience that as well?
All the time. Definitely, whether for better or for worse, I'm on a lot of social media with, animal owners, other vets, keepers, all that stuff. So I see it a lot. And I've been fortunate. I mean, I've had owners get mad at me and say some not so nice things. I've fortunately never experienced, someone saying that you're just in it for the money, but I've had people get mad about prices. And I think just part of it is people don't really know how much equivalent things cost for humans. I think about, we can spay a dog for under $500. And if you got the same procedure in a human, you're talking 10,000 plus. Mm-hmm. And people they have insurance, so they don't realize that.
Yeah, that's a big problem, especially in Canada with the way our healthcare system is. Nobody has any idea how much just the average doctor appointment is, for example, because you don't see it. You do not see a bill. You would have, I don't even know what it would be. I have absolutely no idea. So then you go to the vet and you see sort of the private side of it, and you go, wow, it is tough. But, a vet's not going to do a surgery for free. It has to happen. That's just the way it is.
Yeah, I think there was some study they told us about in school. The average US vet gives away like $60,000 in free services a year, and it was more for Canadian vets. So we do tend to undervalue ourselves, and we don't always charge for our time appropriately. So it's sad, but kind of funny when people get mad at us about, oh, you're in this for the money, when in reality, we give away so much, and we shouldn't. But, ultimately, nobody does this to get rich. We want to help animals. So sometimes we cut corners and prices that maybe our bosses wouldn't be happy about. But in the end, it's, whatever.
Yeah. Yeah, it is. Oh, I just lost my train of thought. It'll come back to me. I'll ask you another question, and if I do think of it, it'll jump back in. But as far as your reptile specific training goes as a vet, because I'm sure that the education starts quite broad and then it tapers down as you begin to specialize. So maybe you could talk a little bit about what you've specifically had to do as a vet or through vet school for a reptile related, or does most of that stuff happen afterwards?
Sure. Yeah. And I think that's a really good thing to talk about, because I know I see on, different social media pages that people are like, oh, vets don't learn anything about reptiles. And It's definitely variable. I went to a school that did not have an exotics program, but I still managed to get a lot of exotics experience. Whereas if you go to, one of the big exotics wildlife schools, you're probably going to have reptile lectures, classes, rotations. So there's definitely some variability. But for me, I mean, we had some basic exotics classes. And then once I realized that, oh my gosh, this is what I want to do. There's a lot of, usually schools have grants and things for students to go to conferences. So I was going to a lot of the exotics conferences in school. And then, most of us, there's clubs. So I was the Herpetile chair for our exotics club. So organizing labs and getting experience. That way, a lot of times we'll shadow or work at clinics. And then once you get into usually third and fourth year at most schools, you can start kind of tailoring things. So, we had more specific exotics electives. And then for my rotations, which was our fourth year, all of my externships, so offsite experiences were all exotics. And I tried to pick places that saw a lot of reptiles. I actually went to a clinic in Australia, which was right when COVID started happening. So I kind of got stuck there, but not too bad of a place to be stuck.
Yeah, that's so. You went there in 2020 at the beginning of 2020, yep. I guess.
I was there in March. Oh wow! I went in. When I went, everyone was still kind of like, okay, it's not that big a deal. No one knows how to wear a mask correctly. And then halfway through, it was like, oh my gosh, I don't know if I'm going to get home. So, I mostly got to finish it. I had to leave a couple days early to make sure I got back, but I still got a ton of really cool reptile experience because they sell wildlife. So there's just this whole back room with, wild bearded dragons and carpet pythons and blue-tongued skinks and everything. So a lot of times students kind of get to take the lead on that. And that's another thing I did is I did a lot of like wildlife rehab stuff. And that's a really good way to get, especially around here, turtles getting hit by cars. We see that constantly. So I got a lot of experience with that too.
So this question might sound callous, but do they allow the students to work with the wildlife rehab just in case, it's more of like a safe place to practice because if something goes wrong, there's no pet associated with it? Is that fair to say?
Yeah, that's functionally it. There's, there's no owner. And, I don't want to say that, they don't care, but, there's still a vet in charge, but we get more opportunities to say, hey, I want to do this treatment plan. Is this okay? And then whatever vet is in charge can, say, yep, that's okay. And then it's, honestly, with wildlife rehab, by the time they come to us, they're usually really sick. Mm-hmm. So, we get to practice. It's looking at a lot of different things, looking at x-rays. So there is a little bit of more wiggle room with wildlife, but depends on the species. If it's something that's really fragile, it's like, only the main doctor and techs are touching it. Nobody else can touch it.
Yeah, but that makes sense. There'd be less pressure with the wildlife, and then like you said, you can try things that you wouldn't necessarily try on a pet. So as far as the wildlife rehab goes in the Australia clinic, for example, are those like animals that were hit by a car, or like what sort of animals are for the most part fulfilling that section of the clinic?
Yeah, there was a little bit of everything. Some of them, they had a bunch of bearded dragons that were really tame. So it was kind of unclear that, were they pets that people lost or released, or were they just, bearded dragons are kind of chill in general. But they'd get some that were, certainly hit by cars, picked up by people's cats. Somebody found it somewhere it shouldn't be. Definitely a lot of the birds would come in injured. And I know that they were having some issues with nidovirus. And so we'd get, some of the really sick, especially the blueies were coming in really sick, and kind of just people would find them and say, hey, this isn't right. I just found this lizard sitting on my porch and it didn't move. So then they bring it in.
Mm-hmm. And that's the other thing that people maybe don't realize or don't think about is that vets often do a lot of that as well. I don't know where the money comes from for that sort of treatment. Is that some from the clinic, or is the government sort of fund some of that wildlife rehab?
Yeah, I'm sure it varies. My clinic sees wildlife, and we basically have kind of free reign to do what we need to do. We wouldn't be able to necessarily say, hey, can we just, front $10,000 to do surgery on this random turtle? But basically we can do what we need to do, and the funds do kind of just come back from the clinic. We generally don't get any kind of funding from outside sources, so we do kind of eat the cost. But at least for my clinic, we see a decent amount during the summer, but it's not a wildlife specific clinic. Whereas, those will have more donations and things like that.
Right. Yeah, that reminds me of what I was going to say a few minutes ago when I forgot, is that's sort of the kryptonite of animal people, is that everybody's so compassionate towards animals. It's very tough to turn that off, right? I see this happen all the time with people who work in rescues or even have a rescue in their own, like run their own sort of reptile rescue, for example. It's just they can so quickly become overwhelmed with trying to save everything. And I'm sure vets is the same way. It's like, okay, you will be tempted to cut corners cost-wise or do extra work or work longer hours because you have this animal sitting there and you just feel so guilty not. And it's probably bad for the mental health side, but I see it all the time especially with animal people. So I'm not sure if you can relate to that.
For sure. Yeah, we definitely, the hard ones are where, the animal needs, whether it's a treatment or a surgery, and it's expensive, the owner can't afford it. And so, we do what we can. We try to make a payment plan. We try and cut costs, and then it doesn't go the way we hoped. And then the owner gets mad. And so now they've lost an animal and they're mad at us, and we're really not getting paid for the work we did. So it's just a bad situation all around. And we're also suckers. We take home so many animals that we probably shouldn't. I definitely was not planning on getting a sugar glider or my little house gecko that was found. Someone drove up from Texas and I think found them in their car and brought them to us, and they're invasive and they're not going to survive in Indiana. So I just took them home, and that's how I got them. And I was not planning that at all.
So with the sugar glider, was that somebody's pet that was brought in and then they left there, or how did that end up in your home?
Yeah, it was a client that called and was looking to rehome them. They didn't feel that they had the time that, they required because they're such intense animals. And my coworkers kind of know that I'm a sucker, and they kind of immediately, I had like 3 of them coming up to me like, hey, you want a sugar glider? You want a sugar glider? And finally I was like, fine, I'll take the sugar glider. And so now I've got him too.
I want to spend a couple minutes on sugar gliders because you're not I've seen them. I know what they are, obviously, the small mammals, but you're not the first person to say that they're quite intense pets and that they're not the best pets, really, because a lot of people get them because they're so cute and they think that they can have, but there's a lot of work that goes into them. So what is challenging about caring for them? Yeah,
I definitely do not recommend them as pets. They are very challenging. One thing is their diet is, we really don't even have a great understanding of it in the wild. It varies seasonally. They're true omnivores. I mean, they eat so many different things: nectar, pollen, vegetation, insects. I mean, you name it. And so trying to replicate that in captivity is really challenging. So we see a lot of nutritional issues with these guys. I mean, you want to talk about metabolic bone disease? These guys are almost as bad as the reptiles for it. They are also very social. They're very active at night. So a lot of people don't realize that. So they get one, and then they have this sugar glider that's pulling its hair out because it's not getting enough attention, and it's keeping them up at night because they're nocturnal. So they really need a lot of enrichment. They need a really specific diet. They need a lot of attention. My guy is not as social as most sugar gliders. I know that he has been bounced around a bit, and I offer him to come and hang out with me, and they're not always the friendliest, I'll say, and he tolerates me, and that's probably about as good as we're going to get.
Yeah, there are definitely quite a few species that float around in the specialty pet domain that are probably not the best pets, and they should really be kept for the zoos in the wild. But I wanted to jump back to, you were saying with the conferences, with the vet conferences. Could you sort of paint an image of what that looks like? Because, I assume there are reptile sort of private collector conferences that get put on all the time. These people come in and do chats and do talks on a species and whatnot. Is it similar to that?
Yeah. They're, if you're like me, where honestly, I think most vets probably are, we're a bunch of nerds. We love learning about animals. So they're honestly really fun because you get to pick this conference at I definitely struggle with paying attention to things and learning about things if I'm not super interested in it. I remember struggling with cardiology, and then I went to a conference and learned about the same concept in ferrets. And I was like, oh my gosh, it's so interesting now. Yeah. So you get to go and kind of learn about what you're interested in. And it varies from, there's some at that clubs, student clubs put on that are a weekend, and there's 2 tracks. There's like aquatics and reptiles, and then it varies all the way to, actually this month there's the big exotics conference is Exotics Con, and it's like almost a week long. There's like 5 different, they call them tracks, but it's basically like how they divide, reptile, bird, small mammal, tech, other stuff. And you go to those lectures, and they're put on by people that have been doing research or are specialists. Sometimes it's case reports. A lot of times they have hands-on labs, which are a really good way to learn techniques. I know that Exotics Con has a reptile ultrasound lab that I was definitely eyeing. But it can even be, for students, it can be exotics handling 101. So it's really variable.
Mm. Yeah, that sounds actually like a lot of fun, and I can see why that would really draw you towards working with reptiles as a career. So let's jump back to that myth that we kind of mentioned earlier, but we'll kind of get deeper into it now with that. Especially on Facebook, you see this all the time. Like, don't waste your time taking your reptile to the vet. Like, sprinkle essential oils on it, it'll be fine. You don't exactly see that, but sometimes you do. Yeah. But anyway, there is that sort of general meme that floats around through the reptile community. I think it's getting a little bit better, but we still see it quite often where people think that vets really don't know anything. So as far as you're concerned, where do you think that myth came from? What caused that myth to exist?
Yeah, this is definitely just kind of my opinion. I don't know for sure. I think there's probably a combination of things. One is, we are still learning a lot about reptile medicine. I mean, if you wrote a book about reptile medicine, which people have, you can probably just have a book. Whereas if you write a book about, dog medicine, I mean, you're going to fill a room with it. There's just so much more that we know about other species. And I think part of that is, public perception. Reptiles just aren't as valued. And, I'm sure people that are in herpetology and trying to get grants, it's the same thing with if you're in vet med and trying to get, your research done on your reptiles. I think there's just there are not as many resources there. There's also, I would say there's probably more vets that either like or at least tolerate reptiles than the general public, but it's still not a super high amount. I have classmates that were terrified of snakes. I was denied housing with some other students because I had a snake. So there's just, there's not as much interest. I think I certainly have classmates that will see reptiles, but I was the only one in my class that had a specific interest in specializing reptile medicine. Whereas, you have how many dozen people that want to be surgeons or cardiologists or things like that.
Hmm. Yeah, I think anybody listening to this podcast will be able to relate to that experience of being the kind of the weirdo that likes reptiles. Yeah. I think reptiles are becoming more popular, which is helping that. But what are some of the mistakes that you've seen vets make? Because obviously you're a new grad as well, so you kind of have that as a fresh eyes too, because you're part of the hobby. So you would have had. It wasn't that long ago where you weren't a vet and you were able to see maybe some of the mistakes from sort of a keeper point of view. So what are some of the reptile-related mistakes that you see vets make?
Yeah. And it's interesting because I think for those of us that are interested in reptile medicine, most of us were keepers first. Like, I think there's a difference between a reptile vet and a vet that sees reptiles. Even if we're not talking being a specialist, there's definitely a difference in, interest and knowledge between those of us that go out of our way to learn about them, because it's just not profitable to do it just because. So I definitely have seen, I've seen the horror stories on Facebook pages where people post like, oh, my vet gave me this care guide and it says like snakes, temperature, and it's just like a random range for every snake species. And it's like, no, and you hear the horror stories of stuff like that. Or, I've seen like, oh, okay, my vet didn't know what species this was or wasn't comfortable handling it. So I think that honestly, some of the mistakes that I see most commonly from colleagues are just not being up to date on some of the most recent information, which honestly isn't that different from keepers. Seeing some outdated things recommended in terms of housing, lighting, enrichment, things like that are pretty common. Medicine-wise, the nice thing is that even if you're not necessarily the most confident with reptiles, we have a really good resource in our colleagues and online forums and things. And we have our own Facebook groups where we post cases, and there will be specialists. It's not the same as, a specialist consult, but there will be a reptile specialist that can come on and say, this is what I think. And so you're functionally talking to a specialist for free on the internet. So that's kind of the nice thing. But I definitely think husbandry, really, vets and keepers are not so different, that there's a spectrum of, keeping in the tiny tubs to the grand enriched enclosures as well on our part.
Yeah, there's almost like two columns. There's the husbandry side, and then there's the medicine side, which are sort of not related. Like I've seen, sometimes you'll see vets who will see reptiles, like you say, they're not a reptile vet, but they see reptiles, so they'll apply the same medicine tactics that they use on mammals, for example, and sometimes that can go haywire. I've seen antibiotics gets prescribed to an animal that ends up killing the snake, for example, just because the vet didn't know, but they were just pulling off of their own information from the guinea pig they've treated in the past or whatever. So there's that, and of course, as like you said, it was only a couple pretty thick textbooks, but not massive amount of information for reptile medicine. So as we progress into the future, that should become more clear for everybody. But then the other column, the husbandry side, that's sort of an interesting side to reptiles. Is I'm trying to think, like with dogs and cats, you don't focus on the husbandry as much because it's more, you focus on diet and exercise, but other than that, there's not much to it. Like with reptiles, there's just so many more layers that the vet should really try to stay on top of.
Right. Yeah. And that's totally true. And I definitely think there's a lot more overlap between husbandry and medicine than a lot of people realize. A lot of the mistakes, or I guess a lot of the illnesses I see, are because of husbandry mistakes. And I mean, I certainly have to prescribe out medications, but it's kind of, I don't want to say shocking, but interesting how often it's just, hey, change this, change that. Okay, we can prescribe this antibiotic to get them through this disease course. And then after that, we've made these husbandry changes and the issue does not keep coming back. So I think that, people I've seen them say like, oh, trust your vet for medicine, not husbandry. And then I know that, not everyone's a nerd like me that makes care guides for fun. So I know that, yeah, that was my COVID project. So I know
that's a great COVID project.
Yeah. So I know that, certainly if you're not interested in that, that's a kind of an undertaking. So you go and you find, the one care guide that, your boss made 10 years ago. And so I totally understand why keepers get frustrated. And sometimes I get frustrated with the things that I see, but I think that there's a lot more overlap than people realize, and getting keepers and vets to kind of work together and share their knowledge is ultimately going to help everyone, including the animals.
Yeah, exactly. It's almost like that bridge needs to be, because we absolutely need vets to maintain a healthy herpetoculture. It just needs to be there, and we need them and they need us. And the great thing about the keepers is they're constantly pushing the husbandry boundaries. We're learning what it means to take care of something, where maybe the vets can take the medicine and fold that into the husbandry much better than the average keeper. I mean, we don't know anything about medicine. What are some of the common mistakes or common illnesses that you see being brought into the clinic?
Yeah. So definitely metabolic bone disease, nutritional secondary hyperparathyroidism is still very common to, different degrees. Sometimes, I have a reptile present that we call it ADR, ain't doing right. They're not eating as much, they're not as active. And we find that, they're not getting the correct calcium supplement. The UV hasn't been changed in a year and a half. And then sometimes they come in where they are totally deformed. I mean, looks like some kind of body horror awfulness, their bones are soft, and it's still so common, even if it's not necessarily to the point where they're, bending in ways they shouldn't be, that we find just, okay, well, we took x-rays and their bone density is actually kind of decreased. And I think that's kind of a really common underlying issue that I see is improper, either calcium supplementation or, vitamin D, I guess, utilization from improper lighting.
Yeah, I mean, as a vet, that must get incredibly tiresome to see that, and it's the community that needs to take responsibility for that. Like it's just so strange that still happens, that somebody will bring in a reptile, and I bet a lot of times the owners have no idea what's going on. They just know something's up, like the leg is bent, it's weird, we've got some bowed legs or something, but they've probably never even heard of metabolic bone disease in a lot of cases. It's like, what's happening? Why is there such a big gap there?
Right. And it seems like what I find interesting is a lot of people, I'll say, oh, have you heard of this before? And they'll say, oh, I Googled it and I was wondering if that's what it was. Or people will get, upset, not at me, but like, why didn't the pet store tell me? Why didn't I know this? And that's, understandable that you buy these kits from the pet store and they tell you, yep, this is what you need. And so then when they come in 6 months later and they've got this reptile that's really sick, and it's like, well, they told me this was all I needed. So I totally understand why they get upset about that. But I get it. It's tough. I made mistakes with my bearded dragon, and I wish I could go back and fix it. But I don't know why I think pet stores are getting a little bit better. I know you had a guest a while ago that kind of talked about things, and certainly I kind of listen to what people are saying at the pet stores. And sometimes I hear things that I'm like, oh, thank God they're recommending that. And other times it's like, why are you telling them to put that chameleon in there? So.
Yeah. It's like I said, I think that gap is shrinking, but it is still kind of it is a bit strange. And as far as you go, how do you stay on sort of, I guess, the cutting edge of husbandry? What do you do to make sure you're maintaining that your sort of foot in that domain?
Yeah, I try to read papers. I feel like my jump into evidence-based keeping, and I'm certainly not perfect. I'm not going to say, oh my gosh, my reptiles have the most perfect husbandry ever. But a lot of it was kind of by random chance. I think I started following someone on like Tumblr that was talking about like, well, actually ball pythons need UV and they need these larger spaces. And I was like, that's weird. I've never heard that. And then that kind of just got into, oh, well, this paper does say this, and oh, this Facebook group does have all these resources. And I try now, I know the Advancing Herpetological Husbandry page is really good about posting stuff. I try to keep up on it with the ARAV, the Association of Reptile and Amphibian Veterinarians page. A lot of times they'll post new research, or even just kind of creeping on some of the cases they're talking about to see, okay, what are the experts recommending? And just honestly trying to, I probably see what a lot of the keepers see. I don't know if we necessarily have special access to any husbandry papers. I mean, when I was in school, I would definitely like download them and save them because, we got them for free. Mm-hmm. But I think I probably see a lot of what, the rest of the reptile community sees. And I just try to stay on top of the species that, I know I see a lot of, like the ball pythons, the corn snakes, the beardies, the leopard geckos, et cetera.
Yeah, I guess it's just a matter of interacting with the hobby as much as possible on a weekly basis type thing. And is there ways that, so let's say hypothetically you have a patient come in, they have a leopard gecko that has metabolic bone disease. So you go through the treatment, and let's just say, maybe the gecko is going to be okay, maybe not. But really what I want to ask is about the owners. What do you do in that situation? Do you give them resources and say, go here for information? Or you said you had done some care guides as well. So how are you helping the actual humans in that situation?
Right. Yeah. So I did end up making my own care guides. I just wasn't, I guess satisfied with a lot of the ones I was finding, because for me, I get pretty detail oriented about these things. And so, I'd find this guide that says, this lizard needs UV. Okay. How much? Where do I put it? And when do I change it? And so I ended up making my own that they're very long and probably more detailed than most people care, but I can kind of highlight, okay, you need to change this bulb every 6 months. You want a calcium powder that is calcium carbonate based. You want to make sure there's no phosphorus in it. I can highlight that. You want to make sure you're feeding a varied diet and that you're gut loading. Usually it's, hey, back off the mealworms. And that way I like having something that I can just hand them. And there's certainly places I'll send them. I think Reptiles has some great information and it's really well laid out. So if it's a species that they have on there, I'll say, hey, go look at this. If you're, for me, a visual person, I really like the way that their guides are set up. Or, certain Facebook pages that, you can talk to keepers on here if you don't feel comfortable, asking your vet. These pages are ones that the keepers are knowledgeable, and you can say like, hey, I'm working on my setup. What do you think? So I definitely have a collection of resources, and definitely every time you have a guest, I'm like, oh, I'm going to write that one down. The Chameleon Central is like, I'm definitely going to make a note of that one. So I try and do a combination, because I know sometimes my giant blocks of text are too much. So if I can send them to a page that I trust, that's a little more user friendly, sometimes I feel like they're a little more willing to get involved.
Yeah, well, that's the tough part, is that you want to provide them with a really thorough care guide, but then there's that balance where if you provide them with too much information, they may not even crack the book, right? They might go, well, I can't even read all that. It's just too much.
Yeah.
But then you don't want to give them the skeleton of the, snake needs UV / here's the temperature range between 60 and 90 degrees. Yeah. So we have to find that balance between. And I think if you give them something in between, it will make them interested, and then pull them in towards the detailed care guides, right? That as long as you have someone that's interested and wants to do a good job caring, they will eventually want to have all that information. But you also can't scare them away with too much information. Yeah,
and I found that kind of, you can't tell I'm a talker, so kind of talking to them about, these are the main points that I have, and we're still curbside, so I swear I can hear their brain spinning, like, oh my gosh, am I going to remember this? So I'll say it, and then I'll say, I know that this is a lot. I'm telling it to you out loud, and then I'm going to highlight it on a care guide, because I find that helps people remember. We have a saying that owners hear like 10% of what we tell them. I mean, it's overwhelming. We're using a lot of jargon. Their animal's sick. They're scared. So I find that if I can do that, and then I hand them this, 10-page monstrosity, where at least I've highlighted the diet section, a little blurb on UV. And if they can at least read that, they're going to be better off. And then if they find, this is really interesting, and they keep reading, great. Now they've learned about, infrared and different types of bulbs to use. And that's awesome. And that's just a bonus.
Yeah, I think that's a really great way of doing it. That makes sense. What are some of the strangest things you've seen get brought into the clinic as far as disease and illness goes?
I don't know if I've seen anything super strange, other than one of my favorites is always, help, my reptile is stuck in this hide. I had a little baby carpet python stuck in like a little AT-AT from Star Wars. And that one was funny, because they're like, oh, he won't come out. And I kind of just poked at him and he came right out. And those are always, you feel like we say that you feel like a firefighter. You're like, oh yeah, I got your gecko stuck out of this hide. And so those are a little bit unusual, just because they're not common, but they're, kind of easy fixes. I feel like a lot of what we see is a lot of the same. Unfortunately, we are seeing more, of the ball pythons with respiratory disease, and a lot of them, I'm recommending tests for nidovirus, and they're coming back positive. So that's one thing that's definitely scary that we're seeing more of. I saw a king snake that had eaten his tail and was starting to digest himself.
Oh my gosh.
That's probably the weirdest one. As far as I know, he's doing great, but he had swallowed about probably 2/3 of his own body. It was pretty crazy.
So he must have been at that for a while for it to actually start breaking down. Because I mean, you see king snakes doing that once in a while. They're so crazy, they'll do that. But he must have had his tail in his stomach for a little bit of time.
Yeah, I think also it was just so far down, because he, like, when it was like one of those magician's ribbons. We just kept pulling the tail out, and it's like, okay, he has to be done, and it just kept going.
King snakes are crazy. So how big of an issue do you think Nido is? Because I think that especially in the States, I shouldn't say especially in the States, but I think because you guys have said it on the show before, it's a lot easier to ship animals back and forth. The weather is more cooperative for the most part, and there's just way more people keeping reptiles. And in Canada, there's just less. So maybe we don't have as much of an issue. But do you see that as a pretty serious thing?
Yeah, it's funny. I was actually talking about this last night with a ball python breeder that came in. I think that it's bigger than we realize, just because people aren't testing and they're not necessarily quarantining. So I would be willing to bet we have a lot more positive animals than we realize, and that some of these animals that are having chronic issues are probably going to come back positive. At this point, it's getting better that people will bring their animals to us when they're sick, but there's still kind of I guess almost a stigma of, even when I talk to friends or family, I'm like, yeah, I saw this really cool snake. And they're like, someone brought a snake for a checkup. And
Hmm.
I think there's still a lot of people that are hesitant. So I think it's probably underdiagnosed.
Yeah, there's just the old bump up the humidity and bump up the heat and clear up the RI just by doing that. Although, so maybe now as you're saying that, maybe that's one positive of this crazy morph craze, is that you have someone with a $5,000 snake that has some bubbling and they're like, I got to bring it into the vet. We have to get this looked at. Maybe that's, one positive there. And so what about managing nidovirus? Because, you have asymptomatic animals. Is there anything, so when you have a positive animal, what do you recommend to the owner?
It depends if it's, a pet or a breeder animal. A lot of times if we're dealing with, a large scale breeder, euthanasia is kind of the best option. Because if you're exposing that snake to other snakes and breeding it and potentially contaminating, I mean, you could really get your whole collection sick. Whereas if it's somebody that has a ball python and this is their pet, it's their buddy, we can sometimes manage it. I mean, ultimately, I don't know if I've had a case that, long term did well, but it's also, I'm also a fairly new grad. So I think it's hard to tell at this point long term. But I've definitely had, even not just Nido, but like crypto and leopard geckos, something that long term is not a great prognosis, but it's their pet. So if we can manage it and help the symptoms and talk about, biosecurity, if you get another animal, then as long as that animal's not suffering, they can live as a pet for, some amount of time. It definitely varies, but some of them, especially with Nido, they get so sick, we do end up recommending euthanasia. Anytime something can't breathe and we can't get it to breathe, that's kind of a hard line for me, because that is so stressful on the animal that I often do recommend euthanasia for those.
Yeah, exactly. So if you have something that's more asymptomatic on both the Nido and crypto side, what are some ways you guys manage it? Well, is there medications, or is it just general biosecurity and good husbandry?
Yeah, definitely. Those are big. There's, it's funny. I feel like things come in waves. I had a run of, little sick crypto geckos, and there's definitely different, treatments out there that aren't necessarily proven 100%, but might work. For, our respiratory infections, do we manage it with antibiotics as needed? Do we nebulize? But certainly husbandry is a big one, making sure they're eating. Sometimes if we have to do a little support feeding with a nutritional supplement to get them just kind of feeling good again, you'd be surprised how much that can kind of make them feel better and get them going. So a lot of it really is support, and then just treating symptoms as they come. If we have, now this gecko just has really bad diarrhea, can we get that to kind of settle down? Or sometimes we can't, and that's what I tell owners is this is all management. It's not a cure.
Mm-hmm. Yeah. That's the unfortunate thing about some of those diseases or some of those the pathogens. What are some of the most interesting species you've had? I'm sure for the most part, you've had the classics, the leopard geckos, corn snakes, ball pythons, and bearded dragons and whatnot. But since you did some time in Australia and you've kind of floated around, are there any that kind of rank at the top as something that's been really fascinating?
Gosh, yeah. I feel like 90% of what we see is bearded dragons, which is great. I love bearded dragons, but, we don't necessarily see, I want to say a while ago, it wasn't me, but my colleague it was some kind of rear fang colubrid that I can't remember what it was. Anytime we have, I love uromastics, so anytime we get those, I get really excited. I get really excited about tegus. I get excited when we have any reptiles, but I don't know if I've seen anything super, super weird or unique. I mean, when I was in Australia, I was like, oh my gosh, carpet pythons, Stimson pythons. And, those are all like, yeah, these are super normal here, but I'm like, they're so cool.
Yeah, exactly. Well, this weekend coming up for us, not for the listeners, I'm releasing an episode about uromastics, so I'm sure you'll enjoy that one, because it made me like really want to buy one myself, because they're such fascinating little creatures. But I know that most of the world is the classics, which is okay because they're a little hardier and whatnot. So I had a couple of questions from my patrons that I was hoping that we could chat about as well. The first one is annual checkups, just discussing annual checkups. I think we as reptile keepers are pretty bad at this, and for the most part, many of us don't do annual checkups. Even me, I've never really, I've had them see the vet, but it's not something that I've practiced on a consistent basis. So what are your thoughts on that? Is this something that should definitely be implemented?
Yeah, I think it does depend on the species. We're like, if we're talking about amphibians, especially, I'm like, that's, I don't necessarily have a great yes or no answer, because that can be really stressful on them to handle. And then there's the risks of that come with handling them. You want to have your gloves on. But if we're talking something like, 90% of the pet reptiles out there, the beardies, the leopard geckos, the ball pythons, the corn snakes, absolutely. I think that there's definitely a couple advantages. One is if it's a species that it's appropriate to get blood on and do annual blood work. Having baseline blood work is so helpful. We actually, at my clinic, one of the other doctors it was a bird that had regular blood work. And the only reason we found something wrong was because something was different from the rest of the blood work from years. It was still normal on the blood work, but it was very unusual. And they ended up finding some pretty significant things in this bird. And I think with, species like reptiles, definitely reference ranges aren't as good, especially if you have a weird species. I mean, if you bring in your Eastern indigo or something, I don't think we have reference ranges for that species. So if you can get baseline blood work, if something happens, we at least have a normal to compare it to. Same with, doing a physical. I think that, keepers that maybe handle their animals every day might notice if there's lumps or things, but a lot of times people don't. And we find something and we go, have you noticed this? And someone, will say, oh my gosh, no, I haven't. And then, of course, just being able to talk about husbandry, which I know kind of, comes back around to the, vets don't know anything about husbandry, but the amount of, mistakes that I catch that are very common, I at least can tell them about it. Whether or not they follow through, that's on them. But being able to discuss that early is so much better than, hey, make sure you get UV for your gecko now, rather than, a year in the future when, oh my gosh, this gecko is, irreversibly sick and with, everything and just isn't doing well.
Well, I think that goes back to communicating with both sides. Even if you are a very advanced keeper and you're incredibly knowledgeable on this one species that maybe the vet has maybe never seen this particular species before, bringing it in for an annual checkup and then even having a husbandry discussion helps the vet in that scenario, right? Then you are actually being a resource husbandry wise to the vet, and then they have that as new information for themselves. So even if you are an advanced keeper and in quotes, everything that there is to know, you can still add a lot to herpetoculture in general by doing that process and having those conversations with the vets, and while simultaneously getting the animals checked up.
Definitely. Yeah. I think that, sometimes vets and keepers butt heads, which is unfortunate because a lot of us are both. Like I kind of said earlier, those of us that are really serious about reptile medicine, I'd say probably most or all of us are reptile keepers too, and probably were before we were vets. And so it just, it always kind of, I guess, is frustrating and kind of sad that there's so much just headbutting when really we all want the same thing. We want our animals to be healthy. And there is a lot that we can learn. I mean, the husbandry stuff that I learned, I learned from other keepers and certainly picked up things from vets as well. But, I think that there's so much there that I wish everyone could just kind of get over this, kind of weird, almost rivalry that, well, no, you don't take your animal to the vet, treat it home, or, oh my gosh, keepers never listen. And it's just unfortunate because I think we do have a lot to learn from each other.
Yeah, I completely agree. I think it would be cool if something like that vet conference that you talked about, if there would be something like that where keepers could attend as well. Obviously, they wouldn't need to attend the specific medicine stuff, but I think it would be cool to unite both worlds in a way where everybody's learning. Like you said, pretty much everybody's nerds at this point, so we just want to be sharing information.
Yeah.
Do you ever do home visits or anything like that? Because some people have these big collections and, it's much easier for the vet to come to them and just pay the bill that way. Do you ever do that, or is that something that anyone in your clinic does?
So pre-COVID, yes. I have done...
Forgot about COVID somehow.
Yeah, I've only done one home visit since COVID, and it was for a coyote. But
oh, wow.
So we see all sorts of interesting things. But that is something that actually I'm really interested in. I've been talking to my boss about getting hot snake trained because I would love to be able to do some work with venomous snakes. Not necessarily jumping into, hey, let me hold your gaboon viper, but if I could at least like have a general idea on how to safely work with them, that would open up, potentially more opportunities for sick animals that otherwise can't get care. And I think that, with animals like that, or with large collections, home visits and doing kind of almost a herd health approach are a really good way to do it, because I wish that was more common, because if you have a vet come in, look over your collection like we do with, honestly, even almost like we do with farm animals or, facilities that have, commercial facilities, and we can at least say, okay, these animals look healthy. Your husbandry looks good. Now we have a client-doctor relationship. And when someone calls and says, hey, I have my 200 snake collection and this many have these signs, cool. Now we have a relationship that legally I can dispense medications, I can give advice. Whereas otherwise, if someone calls out of the blue and says, I have 200 snakes and they're sick, I literally can't do anything unless I see the animal.
Right. So to make it a legal transaction, we'll say you actually have to see that animal in person, or else nothing can happen.
Exactly. Yeah. We cannot legally, or honestly, practically, we can't give advice for an animal we haven't examined. And now that I've been practicing for a while, and I realize how many things can sound like, oh, slam dunk, it's this. And then the animal comes in and you're like, oh no, there is something else going on. I wouldn't even want to make a diagnosis without seeing an animal, even if I could, because that just leads to misdiagnosing something, and not a good way to go.
Yeah. But yeah, I think the home visit would be very appealing to many people, because you also save the stress from the animal. Like, for example, if you have very flighty geckos, like even my day gecko, I feel like she's very nervous and doesn't like to be handled, obviously. Mm-hmm. And I feel like if you're somebody that has a large collection of animals like that, it'd be so much easier and less stress for the keeper too. Like, there's nothing worse than trying to catch fast day geckos. It's horrible. It would take you all day to be able to go to the vet. So that would make everything a lot simpler and more relaxed for the animals.
For sure. And that's totally, that's a good point. I mean, when I just had my ball python and I was a student, I did my yearly wellness visits, but now like my red-eyed crocodile skink, I would never do that to him. That would be so stressful. So that's a really important point, is some animals just are too stressed out by handling and, and examine things. And we don't want the exam to be something that is harmful for them. Mm-hmm.
Yeah, so it's a sort of an animal by animal situation. And another question that I had that was, I think, interesting is snake supplementation. And this is something that we don't really talk about, you don't hear a lot about. Obviously, we hear supplementation on all the other, especially with geckos and lizards and whatnot, when you're supplementing with powder and everything. But I think the general theme is that if the animal is eating a whole prey diet, you don't necessarily need to supplement, because they're getting everything with the whole animal. Mm-hmm. But if we're feeding the same thing for their whole life, they're bound to be missing something, I'm sure. And who knows, I think as snake keepers, we often forget that the rats that we feed are also in some sort of captive situation. And who knows what the guy's feeding them? Is he feeding them dog food? Are they having access to exercise? Are they fat? All these different things. And so what are your thoughts there? Do you think, is there a space for snake supplementation?
I think it's a really interesting area. I'd love to see some, kind of studies on breakdowns of the nutritional value of some of these things. And I don't think it's something we really know. It's definitely an area that I think will probably continue to become, I guess, more relevant, because I agree 100%, when we're feeding just these frozen thawed rodents, that's not what they eat in the wild. They don't eat farm raised rats. They don't eat farm raised chicks. Definitely in the meantime, I think dietary variety is one of the best things we can do, but whether or not that covers everything, I don't know if we know, or if we'll ever know. I know that, this isn't reptiles, but with a lot of other species, there's been at least some data that having, commercial diets, when these animals are on it, we don't see the same kind of nutritional issues. So at least, some animals have a commercial diet that can be part of it, like sugar gliders. There's all sorts of different kibbles and powdered things. And, same with ferrets and hedgehogs and all that stuff. And whether or not you're a person that agrees with the commercial diets, it's an interesting point that we don't see the same nutritional issues with animals that are on that. And we don't have that for reptiles. So I think there's certainly more to learn there.
Yeah, it is. It is interesting, especially on the snake side. I mean, obviously, with like crested geckos, for example, we do have the powders and whatnot, so they have their whole meal. But yeah, you do wonder how much they're missing or lacking when you're just feeding them the same thing over. And I don't even know how you would supplement. I know that one of my patrons was saying that he was in contact with a science center that was supplementing vitamin D. Now I'm trying to remember how they were actually doing it. I actually don't know what they were doing specifically to actually supplement, if it was like being injected into the prey item or sprinkled on. Like, have you had any experience with anybody doing that with snakes? But I guess besides doing like a carnivore diet situation.
I've never had anyone that does that. I was kind of thinking that too, like, how the heck would you even do that? Because I mean, I think about like my ball python, who I usually feed him yellow chicks, and I tried to feed him a black and white chick, and that was no. So like, if I had to put powder or something on it, I don't know how I'd get him to eat it.
Exactly. Yeah. So that's, I guess, maybe the next domain of reptile health. Maybe that will be, we'll start seeing that. Who knows what that will look like. As far as yourself goes, how much pressure do you have just to try to stay up to date? We already talked about kind of how you stay up to date, but do you feel pressure to make sure you're constantly progressing research-wise and staying on top of things? Does that make you stressed, or is that kind of just part of it?
I think I probably stress myself out because I have kind of taken on this role at my clinic of making these care guides, and it's something I enjoy doing. But I mean, even with the ones that I put, hours and hours of research into, I found these peer-reviewed articles. I go back and I look at them and I'm like, is that really what I meant to say? Or, I've learned something else since then. So, I want to make sure that I'm not giving outdated information, certainly, partly because it is my job to advise owners, but also I feel like I'm definitely putting a little bit extra pressure on myself because I've kind of taken on this role. But I mean, the good part is I enjoy learning about it. So when I see that there's, somebody posts a new article on one of the vet pages, I'm like, ooh, I'm going to go read that. Mm-hmm. So it's, I guess, pros and cons there.
Yeah. And I think I know you'd run through kind of what animals you had. I think that was off air. So maybe you could just, we'll kind of wrap up you can let everybody know what you keep right now as far as reptiles go.
Yeah. So I've got my ball python, of course, little Western hognose. I've got a leopard gecko, red-eyed crocodile skink, my little house gecko, and then an axolotl. And that's it right now. The goal is eventually to have a reptile room, but right now I'm renting in a pretty small house, so I've kind of gotten to capacity with the reptiles. Yeah,
that's kind of where I am as well. Do you have any species that you have on your want list that you will get eventually when you do have a place that's a little bit larger?
I have such a long list. I really like Ackie monitors. That's like top of my list. They just seem like such cool, intelligent animals. And, if I won the lottery and could have a giant enclosure, I would also get an Eastern indigo. But other than that, I honestly don't know if I have anything super exciting that I want. I want a crested gecko, gargoyle gecko, just all the standard stuff. Honestly, I'm not really a person that focuses on one species. I'm like, I want one of everything.
Yeah. So. Well, and it's probably good as a vet too to have your experience across like several different genre and species. One thing that I was going to ask as well that I meant to say earlier when you're talking about potentially training to work with venomous species, is that something that you would just have to go out on your own and look for a course, or would your clinic help you find a training course for that, or how does that work?
So I actually found a course through I think it's the Rattlesnake Conservancy, and they have two levels. One is basic about venom, safety things, and then there's another that I think the second part goes more into like tubing and handling and things. So I have no idea how I found it. I just randomly came across it and sent it to managers, the boss, and I was like, "Can I do this?" And they're looking into it. I think that, insurance is kind of an issue, and right. I mean, COVID traveling is an issue. And also the other question is, we want to get a couple of our techs and assistants trained, so it's not just me. And then if we had a venomous snake that had to be hospitalized, where do we put it? Do we want to have a locked door so no one else can go in there? So they're willing to help. It's just right now the practicality of it is making it difficult.
So if just say theoretically you went through all that training and you guys had some techs that were also trained, would you guys accept venomous snakes being brought to the clinic, or would that only be a home-based treatment? Like you said, you might have a locked door and whatnot, because it almost sounds like you'd have to do quite a lot to the clinic just to make sure you could do that safely too.
Right. My kind of vision, I guess, is that it would be mostly home visits, and it would only be in clinic for, hospitalization / emergency situations, just because that's, you don't want to put anyone else in danger, and transporting that snake is, certainly can be a big risk, especially, we have a large clinic with people that would not be trained. So ideally, I would love to do more of a home visit situation. And that seems to be, from the limited kind of hot snake type, medicine training things I've been to at conferences and things, that seems to be the way that most vets do it. At least most vets do it safely, I should say.
Mm-hmm. Yeah. And anytime, even it poses a risk to the owner to bring them in as well, because you're doing an extra step there. So I think that probably makes sense as well. Mm-hmm. Well, Dr. Love, I really appreciate this conversation. Is there anything that we didn't cover today that you wanted to mention before we wrap up?
I guess just if you have a concern with your vet, bring it up to us. We want to have a conversation. And if you don't feel like you're clicking, it's okay to go somewhere else. And there aren't necessarily a ton of us that are super into reptile medicine. You might have to drive. If you can find that out before you get an animal, you'll be so much better off. So yeah, just we're people, we're animal lovers, talk to us. We really would prefer that, honestly.
Yeah, and I think another good point to add to that is talk to your reptile community, because quite often somebody in there will know what vet in your area is the one to go to. Typically
absolutely.
There's a couple in the city, and I think actually Reptiles has a list of vets, so maybe that's something that we could get you on there as well. I'll talk to Mariah, because I think she, maybe I'm remembering this wrong, but I don't think so. I think she has a list of really good reptile vets on her website.
I think we're actually on there. I feel like I remember seeing us.
Oh, okay, yeah. Good. Yeah, so that's another resource as well. Mm-hmm. Awesome. Well, can you let everybody know if they want to reach out to you and say hi? And I'll put a caveat in, this is not to have free vet service, but if they did want to reach out and contact you, where would they do that?
Yeah. So my email is just catmlove, that's CATMLOVE @gmail.com. And yes, please do not ask me for vet advice. I will not respond. But if you have questions about getting into this career, or if you are a vet student / pre-vet student and you want to do an externship, or if you just want to talk about reptiles, absolutely feel free to email me.
Excellent. I will make sure that is in the show notes for everyone as well. Mm-hmm. Dr. Love, thank you so much for joining me this afternoon. I love this conversation. I think it's always good to try to meld these two worlds together. So I think this conversation did a good job of that. So thank you very much.
Yeah, thanks for having me.
All right, that is the end of that episode. Dr. Love, thank you so much for jumping on an episode of the podcast. Thank you for listening to the show and being a guest. That was wonderful. And thank you for providing your email address at the end. Again, I'll put the caveat again in. If you're a listener, that email address is to talk reptiles, to talk about what it's like to be a vet, or any questions about going into vet school and so on. Just like Dr. Love said, please don't email her with ailments or issues that you are experiencing with your reptiles. It's just she's not able to answer those questions. But again, like she said, if you want to talk reptiles, the email's there for you to contact her. Thank you so much for listening to the episode. I do hope you guys enjoyed it. If you did enjoy it, feel free to share it on Instagram or Facebook. That does always help. If you want to join us on Patreon and be part of the Patreon Zoom chats, as well as have early access to episodes, jump over to patreon.com/animalsathome. And thank you so much to customreptilehabitats.com for sponsoring this episode of the podcast. Again, affiliate links are in the show notes as well as the YouTube description. And if you do make a purchase, a small commission comes back to me at no extra cost to you. And this building is rattling right now. I feel like I'm yelling. I can hardly hear myself think. Hopefully it doesn't sound like I'm screaming into the microphone. But that is it for today, guys. Thank you so much for tuning in. I will catch you next Sunday.